Hi, my name is Lindsey Engel, and I'm going to be doing a full head-to-toe assessment for MSN 610 for Northern Kentucky University. I have already washed my hands, provided privacy, explained everything to my patient, and taken a full set of vital signs which were normal. I also documented her height, her weight, and her BMI in her chart. How are you doing today? Do you have any concerns?
I do.
Do you know why you're here?
To get a head-to-toe.
Okay, what is your full name?
Cindy Mullen,
How old are you?
39.
Where are you right now?
I am at a clinic.
What year is it?
2019.
And who is the president?
Donald Trump.
So after talking to her, she's answering questions appropriately with clear speech, and we'll move on to our assessment. We're going to start with the head. First, I'm going to look at it. Hair is evenly distributed throughout, and her head is normal size and symmetrical, which means she's normocephalic. And I'm going to palpate. Do you have any tenderness?
I do not.
Okay. So I'm feeling for any lumps, bumps, lesions, indentations, and infestations, and no tenderness with palpation?
No.
Okay, so next I'm going to check the cranial nerve number 7, and this is checking for facial symmetry. So I'm going to look at her eyebrows, her eyes, and her nasolabial folds, which are all symmetrical. Can you smile for me? And frown. Raise your eyebrows, and puff your cheeks out. So everything looks symmetrical, so her cranial nerve number 7 is intact. Next, I'm going to check her cranial nerve number 5, which is sensation of the face. I'm going to put this cotton swab on your face, and I just need you to tell me if you can feel it, and then at the end, we'll discuss whether it's the same or different on each side.
Okay. Same. Or I can feel it. Yep. 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 Yep.
Did it feel same on both sides?
Mm-hmm.
Okay. So cranial nerve number 5 is intact. Next, we're going to check her sinuses. I'm going to palpate, put some pressure. Any tenderness?
No.
Okay. No tenderness in the maxillary sinus? Any tenderness?
No.
And no tenderness noted on the frontal sinuses. Next, we're going to check the temporal mandibular joint. Any pain or tenderness?
No.
Go ahead and open and close. Open and close again. And then side to side. All right. No clicking or crepitus noted. So next we're going to move on to the eyes and check the cranial nerve number 2, which is the visual acuity using the Snellen test and the peripheral vision. So this is the Snellen test. I'm going to stand about 6 feet away, and I need you to cover your left eye first, okay, and read the lowest line you can.
LTFPH.
Okay, and switch eyes.
LTFPH.
Okay, and
LTFPH.
okay, so you're 20/20 in both eyes. And now we're going to do your peripheral.
Okay.
All right, I'm going to wiggle my fingers, and you tell me when you can see them.
No. No. No.
Okay, switch eyes.
No. 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 No.
Now with the Snellen test and the peripheral vision test, that indicates that her cranial nerve number 2 is intact. So next we're going to move on to checking her pupils, her extraocular movement, and the 6 cardinal points of gaze. So just look right at me. Her pupils are equal and reactive to light. Okay, so we're going to do the 6 cardinal movements.
Okay.
So I need you to look at this, keep your eyes on it, and don't move your head.
Okay.
Now keep your eyes on it, and I'm going to come in. Okay. Do it one more time. And that all indicates that 3, 4, and 6 cranial nerves are all intact. Now I'm going to look in your eyes with the ophthalmoscope, checking for the macula, the fundus, the optic disc, the blood vessels, and checking for red reflex. All right, just look right up. And all anatomy is intact, and there was a positive red reflex. So now I'm just going to inspect our eyes. The sclera is white and glistening. The irises are equal and blue. Pupils are equal and reactive. And then we're going to check the conjunctiva, which is pink and moist. All right, so now we're going to move on to your ears. Okay, I'm going to palpate your ear. Does that hurt at all? Any tenderness? Okay. Any tenderness? No. Okay. There's no abnormalities on the external structures of the ears. Now we're going to look inside. Tympanic membrane is pearly and gray with no signs of infection. And right tympanic membrane is visualized pearly and gray with no signs of infection. Now we're going to do the whisper test. This is checking for cranial nerve number 8. I'm going to whisper something in your ear and you just tell me what I say.
Okay. MSN 6. Final exam.
Very good. So your cranial nerve number 8 is intact. So we're going to move on to the nose. The first thing we're going to do is check the cranial nerve number 1, and this is smell. Go ahead and close your eyes. And I'm going to wave something in front of your nose, and you just tell me what it is. Okay. So cranial nerve number 1 is intact. Now I'm going to palpate down your nose. It is midline. Any tenderness at all? No abnormalities on the exterior structure. I'm going to look inside your nose. No drainage noted, and the turbinates are visualized, and they are pink and moist. Now I'm going to have you plug one nostril and breathe in, and then do with the other one. Any difficulty or concern with that? No. Okay, very good. So now we're going to move on to the mouth and the throat. First, I'm just going to visualize her lips are pink and moist, no signs of dehydration. Go ahead and open your mouth. Okay. And her buccal mucosa is pink and moist as well. I'm going to look at her teeth, her tongue for any abnormalities. I don't see any dental issues. Tongue is pink, moist, rough on the top. Go ahead and lift her, and smooth on the bottom with no abnormalities. We're also going to take a peek at your, go ahead and stick your tongue out and say ah. Okay. When she does that, her uvula goes up, goes up, and her soft palate goes up as well, indicating that cranial nerve number 9 and 10 are intact. Go ahead and stick your tongue out. All right, her tongue is midline, and go ahead and move it side to side. Okay, and that indicates that cranial nerve number 12 is intact. All right, so we're going to move on to your neck. Okay. Any pain in your neck at all? No. Okay, so we're going to check your glands. We'll do the parotid, and the salivary, and then your thyroid. Go ahead and swallow for me. Okay. No abnormalities noted there. We're going to check your range of motion. Go ahead and flex, extend, head back, shake your head no slowly, and then your ear to your shoulder, and ear to your other shoulder. Any pain with that? Mm-mm. Okay. So full range of motion in her neck. So now we're going to check cranial nerve number 11. I'm going to press down and go ahead and shrug your shoulders. Okay? And Go ahead and turn your head against my hand. Good. And good. All right, so that indicates that cranial nerve number 11 is intact. We're going to move on to your lymph nodes. So in a circular motion, I'm just going to check all your lymph nodes. This is the preauricular, postauricular, occipital, submental, submandibular, jugulo-digastric, superficial, cervical, and then deep cervical chain, and then posterior cervical, and supraclavicular. I need you to shrug your shoulders. No enlargement of the lymph nodes are noted on palpation. So now we're going to check your carotid pulse. We'll do one side at a time. Carotid pulse is strong, 2+. Rate is within normal limits, and rhythm is regular. We'll check the other side. And the other side is the same. Rate is within normal limits, rhythm is regular, and it's a 2+. So now I will listen and check for any bruits. No bruits noted on auscultation. So now we're going to move to your upper extremities. First, I'm going to have you hold your hands out, palms up, and leave them up for 10 seconds. I'm just making sure there's no arm drift. Very good. You can put them down. We're going to look at our skin. We're looking for the color, temperature, and any abnormalities as far as a rash, macules, anything like that. I don't see anything concerning. We'll look at her fingernails. Her fingernails are pink and hard and no signs of floating present. Do the same on the other one. Oh, and cap refill is brisk, less than 2 seconds. Now we're going to check reflexes. Okay, movement of the fingers with that one. Movement of the fingers with that one. We'll check her pulses. We're going to check brachial, she's got 2+ brachial pulse. Rate is within normal limits and rhythm is regular, and we'll do the same for the radial. Two plus radial pulse. Rate is within normal limits and rhythm is regular. We would do the same on the other arm as well. All right, now we're going to test your strength. Squeeze my hands as hard as you can. Okay, put your arms up. Try and pull. And try and push. Okay, good. Strength is good bilaterally. Now I'm going to have you put your finger to your nose into my finger as fast as you can. Okay. Other one. Okay, very good. So now we're going to move on to respiratory. So first I would inspect her chest and her back, make sure it's symmetrical, make sure there's no concerning lesions, macules, moles, anything like that. I would also be inspecting for ease of breathing and any distress at all, any retractions, use of accessory muscles. It looks like there's ease of breathing. Are you having any shortness of breath? Okay. I'm going to go ahead and listen to her lung sounds. Take some deep breaths in through your nose, out through your mouth. Lungs are clear bilaterally, no abnormalities on the chest noted, and work of, she's no distress. All right, so now we're going to move on to, we would do the breast exam at this time, but we're going to defer that. We can check her lymph nodes, do lateral lymph nodes, pectoral, central, and then supra scapular in the back, and then her breast exam for this deferred. So now we'll move on to your heart. We're going to check for any jugular vein distension. So she would normally be sitting at a 45-degree angle. I would have her turn her head to the right and check her jugular vein, which is flat and normal at this point. No jugular vein distension noted. I would do it on the other side as well. Also, no jugular vein distension noted. And then I will listen to heart sounds. So I'm listening to aortic. Pulmonic. Tricuspid. And mitral. And S1 and S2 are present, no murmurs, and no irregularities. And then I would listen to her apical pulse for 60 seconds, fifth intercostal midclavicular line. And we would do that for a whole 60 seconds. Rate is within normal limits, rhythm is regular. So now we're going to move on to abdomen. I'm going to have you lay flat for this one.
Okay.
Okay, so first I'm going to inspect. I would be looking for any scars or skin issues, and look at the contour of her abdomen and look for symmetry. Any previous bowel surgeries, belly
No.
surgeries?
No.
Nothing? Okay, are you having any belly pain right now?
No.
Okay, so first I would auscultate for bowel sounds and for the abdominal arteries, the aortic, renal, and femoral. Next, I'm going to palpate. I'm going to do light palpation first. Check for any pain or tenderness. Any pain at all? No pain anywhere? No. Okay. And then deep palpation. No pain or tenderness?
No.
No masses or abnormalities noted. I'm going to check your liver. Go ahead and breathe in and hold. No abnormalities noted. Liver appears to be correct size, no enlargement. I would also palpate her inguinal lymph nodes as well at this time. All right, so we're going to move to your lower extremities. All right, I'm going to inspect your skin. I'm going to inspect for any rashes, color, temperature, any varicosities. Are you having any pain in your limbs? Okay, and then I would check her nails. Pink and hard, they're actually painted right now, but I would also check for her cap refill on all of her toes. I would check for her pulses, her popliteal. Her dorsalis beatus. Take a picture here. posterior tibialis. And all the pulses to our lower extremities are 2+ with a regular rhythm, and rate is within normal limits. I'm also going to do at this time her range of motion. So, well, you're already bent. Go ahead and lift your leg up. Okay. Other one. Okay. And can you move your leg out to the side? Okay. And the other one. Good. And her strength.
2 minutes now?
Yeah, that's fine. All right. Push on my hands. Pull back. Okay. And we will check the Babinski reflex at this time. Positive on the right. Positive on the left. And then we'll check her patellar reflex. 2+ on the left. 2+ on the right. I'm going to have you stand really quick and run your heel of your left foot up down the shin of your right leg. Okay? Go ahead and do it again. Okay. Go ahead and sit back down. So now we're going to check your sensation and just make sure it's equal on both sides. Yeah. Mm-hmm. Same on that side. Mm-hmm. Yeah. Yep. Same on both sides. Yep. 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 Everything's equal. Mm-hmm. Okay. And now we're going to do sharp and dull. So I'm going to have you close your eyes, but first I'll show you what sharp feels like. Okay. That's sharp, and that's dull. So go ahead and close your eyes, and whenever I touch you, tell me if it's sharp or dull. Sharp. 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 Dull.
I can't feel. Sharp. Sharp. Dull. Dull. Sharp. Sharp. Ooh. Sharp. Dull. Dull. Dull.
Okay. Okay, you can go ahead and open your eyes. So I'm going to have you hop down, and I want to watch you walk. Just take a couple steps that way for me, just normal. Okay? You don't feel off balance or anything?
No.
Okay? And then go ahead and walk towards me with your heel to your toe. Okay? Just a steady gait. Everything's normal with that. So now we're going to look at your back.
Okay.
Any problems with your back?
No.
Okay, I'm going to go ahead and palpate. Any tenderness with palpation?
No.
Okay. Spine appears straight. We're going to look for symmetry with her shoulders, her scapula, and her gluteal folds, and everything looks symmetrical. Can I have you bend over?
Sure.
And this I'm checking for the spine. Make sure it's straight, no curvature, which it's straight. Okay, go ahead and stand back up. And then looking in from this side, I would make sure that the thoracic spine is convex and the lumbar spine is concave. Now face me. We're going to check range of motion. Trying to keep your hips stable. Mm-hmm. Go ahead and turn with your back. Okay. Any pain with that at all?
No.
Okay. That completes our head to toe assessment.